Okay, good afternoon, everyone. It looks like it's 1:30 and most people are now with us. So welcome to our virtual education program today. My name is Roseanne Burke and I'm the Manager of Advocacy at the Alzheimer's Society of Nova Scotia. Today's presentation will provide an overview of medical assistance in dying, or MAiD, how the program works, and informative facts for all Nova Scotians to be aware of. The expert presenters joining us today from Nova Scotia Health will answer common questions pertaining to MAiD and dementia to help people make informed decisions. We're excited to be able to connect with you and learn with you today on this very important topic. We are using Zoom for healthcare, an online technology that helps us connect with you securely. If you are experiencing any troubles, please send a message in the chat box to Beth for Zoom support, and they will try to help you through it. For today's session, all participants have been muted and video turned off. And with these privacy measures in place, we will be recording the session for future use. Next slide, please. As we begin, I would like to acknowledge that we are in McCarthy, the ancestral. Can you hear me okay? As we begin, I would like to acknowledge that we are in McCarthy, the ancestral and unceded territory of the Mi'kmaq Nation. We are all treaty people. The Alzheimer's Society of Nova Scotia is committed to undertaking work to create collaborative and respectful relationships. Together, our goal is to identify and develop tools that align with the beliefs and needs of Indigenous, African Nova Scotian, Acadian, and all equity-seeking communities across the province. We are committed to walk as community members and allies in the elimination of racism and discrimination from healthcare and across society. Next slide, please. At ASNS, we are working towards becoming a more diverse and inclusive organization where all Nova Scotians feel a sense of belonging. We use the acronym IDEA, which stands for Inclusion, Diversity, Equity, and Accessibility, to apply a person-centered lens to our work and ensure we are fostering a sense of belonging in all that we do. To facilitate this work, we are grateful to be collaborating with the many organizations indicated on this slide. We are always open to growing and learning, so please feel free if you would like to reach out and work together to help foster a sense of belonging for all. Next slide. So thank you very much for joining us this afternoon. Our audience includes people living with dementia, people caring for someone with dementia, and people who want to learn more. We will have about a 40-minute presentation followed by 15 minutes of questions and answers. Please feel free to ask questions using the private and confidential chat box addressed to Beth at Zoom support. Questions will only be seen by Beth and the Alzheimer's Society, and we will get to as many of them as we can at the end of the presentation. It is now my pleasure to introduce our presenters. The first is John McCarthy. John McCarthy has worked with Nova Scotia Health since 2004 and has been the MAiD Program Lead since 2017. While most of his background is in health system project management, the prospect of taking on the role with MAiD was a welcome opportunity and a chance for him to work in a clinically focused way. In his spare time, John volunteers with small community-based organizations and coaches youth sports. Welcome, John. Dr. Gosson is a psychiatrist and co-medical lead for the Medical Assistance in Dying program and a MAiD assessor. She has a keen interest in working with patients requesting MAiD where capacity or mental health concerns are at play. Aside from her work with MAiD, she also works as a psychiatrist in the QE2 emergency department and has a private practice focusing on veterans and military personnel. She was born and raised in Ontario, but now makes her home in Halifax with her husband and German Shepherd. Welcome, Dr. Gosson. And Max Meyer is the Clinical Services Manager for Medical Assistance in Dying. He supports the day-to-day activities of the MAiD program across the province. Prior to this, Max worked as a team lead for several years within Nova Scotia Health, and he's also worked as a human tissue bank specialist and as a cardiac perfusionist. Max grew up in Cape Breton, but now lives in Halifax with his 2 children. Welcome, Max. Thank you to all of you for being here today, and the floor is now yours.
All right. Thank you, Roseanne and Beth. Really appreciate the opportunity to speak with you and your constituents today. We welcome any opportunity to meet with folks and discuss MAiD on a factual basis. We know that there's a lot of misinformation going on around MAiD, so we're happy to talk about the facts. We want to acknowledge right off the top that this can be a bit of a charged and controversial topic for some people. Some people have moral, ethical, or perhaps religious objections to MAiD. Want to point out, though, again, that this isn't really the forum to discuss any opposition to MAiD. We just want to discuss the law and the process that we follow here in Nova Scotia. So MAiD has been legally available in Canada since 2016, and we're going to discuss it from that perspective. Next slide here. So we're going to review, in terms of our objectives, we want to review the eligibility criteria, the safeguards that are in place, and how we manage cases. Obviously, we're going to focus on MAiD in relation to dementia. And I wanted to point out as well that anybody who wishes can request a copy of this slide deck. So you don't necessarily have to take notes, but certainly if you have questions, write them down. We do want to address your questions at some point at the end of the presentation or in a written format afterward. Pardon me. So there is a lot of support for MAiD in Canada. It's well researched and well known that the majority of Canadians support it, but there are those who are opposed to it, and in some cases, opponents sometimes, unfortunately, create and distribute false information, and that is unfortunate because it creates uncertainty among people who are generally vulnerable given their health circumstances. And so we want to make sure that again we focus on the facts. And the final point there is that we only act at the direct request of a person seeking MAiD. A lot of people wrongly think and they say that we actually come after people looking to perform MAiD, and that is certainly not the case at all. So I want to make sure that's very clear. Because there's so much information kind of floating out there in the pipeline about MAiD, we want to say that it's really important that you seek information from reliable sources, and we want to be one of those reliable sources. There are many online resources through the Nova Scotia Health Authority, through the federal government and whatnot. Dying with Dignity is another advocacy group based in Toronto. Great organization. And if ever you have any questions or concerns about MAiD, don't ever hesitate to call us here at the office. Our numbers are listed there. You can call or email. We're happy to speak with anybody at any time to discuss your questions or your fears around MAiD or whatever the case may be. We would always like to discuss MAiD from that perspective, again, on a factual basis. Okay. Sorry, my slides are a little bit out of whack here. Having trouble advancing the slides. I apologize for that. So as I mentioned earlier, MAiD has been a legally available end-of-life option for Canadians since June 2016. And when the law came into effect, it created exemptions from what's called the offense of culpable homicide to permit nurse practitioners and physicians to provide MAiD and permit pharmacists, registered nurses, and administrators like Max and I to be involved in the process and to help facilitate MAiD for those who would like to be assessed for and who meet all the criteria around MAiD. The law also created new offenses for those who fail to comply with the safeguards that are built into the law as well. I want to point out that the law applies equally across Canada in every province and territory, but healthcare, of course, is delivered by each of the individual provinces and territories. So there's not a cookie cutter approach in terms of how MAiD programs are delivered or administered across Canada. Each province and jurisdiction takes their own approach. Okay, so sorry, I'm having to reference my slides here. MAiD or Max, I think we're over to you now at this point.
Yep. Thanks, John.
Okay, sure.
Hi, everyone. Like John said, thank you for the opportunity to present the information to you today, and we look forward to any questions that you might have. So in terms of the eligibility criteria for MAiD, there are several, and they are written into the law federally, into the criminal code, as John had mentioned previously. So the criteria, the first one is that any individual looking to receive MAiD within Canada must be or must have eligible for health services that are funded by the federal government, a province, or a territory. So in the most basic terms, anyone with a Canadian health card, that is one of those criteria. That does also include military members who, while they have their own healthcare processes and areas to access it, they are still covered by that federal law. Another criteria is that you must be 18 years of age or older. So in Canada, there is no such thing as MAiD for minors. You must be mentally competent, and Dr. Gosselin will elaborate on some of those aspects of capacity and competency. But you must be able to understand and make your own healthcare decisions. And that is what is known as having capacity. So the capacity to make your own healthcare decisions. You do have to have a grievous and irremediable medical condition. And our next slide will go into that a little bit. You must make the request for MAiD on a voluntary basis. It cannot come as the result of outside pressure or influence. So your family members, friends, anyone you know, nobody can actually pressure you into having MAiD. And we do have safeguards in place to ensure that if someone is pressured, that we can identify those. And you must also give your informed consent to receive MAiD. And what that means, and it plays into the bullet about capacity, in order to give informed consent, you must be aware of all the alternatives. Assessors and providers for MAiD do discuss any options for treatments if they exist, as the individual does have to know all of their options in order to be considered informed consent. Next slide. So what is a grievous and irremediable medical condition? Well, those are any serious disease or disability, and for the time being in Canada, that does exclude mental illness as the sole underlying medical condition. The person must be in an advanced state of decline, and that decline cannot be reversed by treatment options. And the person must be experiencing physical and mental suffering from the illness, disease, disability, or the state of decline in their health that cannot be relieved under the conditions that the individual considers to be acceptable. So as John mentioned previously, in Canada, as of 2017, MAiD was made legally available, but there have been some changes to the criminal code since then. And the largest was in March of 2021, and it created two different avenues or tracks for MAiD. The first one are all the patients whose death would be considered reasonably foreseeable, or we refer to it as RFND, a reasonably foreseeable natural death. So those are individuals with diseases and illnesses where clinicians can accurately say that this individual will most likely pass away within a specified period of time, and it has to be reasonably foreseeable. Under this track, there's no waiting period between your assessments. and it requires one witness who will sign paperwork witnessing the patient's request. Track 2, or the second avenue for MAiD in Canada, are all of the diseases, illnesses, and conditions where someone's death is not reasonably foreseeable. And that is the track that was added in 2021. For track 2, there's a minimum 90-day waiting period between your assessments. And that 90-day waiting period serves two functions. One, it's to give the patient more time to reflect on their request, to ensure that it is not made in the moment, that they have time to reflect on it, think about it. Sometimes they change their mind. The other part to the 90-day waiting period is that it gives the assessors for MAiD an additional period of time where they can consult experts in the conditions the patient has. So for us here in Nova Scotia, any nurse practitioner and any physician that's licensed to practice here is allowed to conduct assessments for MAiD. But for example, a family physician may not be an expert on or an expert in psychiatry, may not be an expert in cancer care. And that allows them to reach out and consult with those experts to ensure that there are no other treatment options available, and there's nothing else that would alleviate the patient's suffering. Now, which track someone falls under? There are some general guidelines or examples. I mean, for reasonably foreseeable natural death, someone who is at the very last stages of cancer, they're very much reasonably foreseeable. Whereas a non-reasonably foreseeable natural death would be someone who's in the earlier stages of multiple sclerosis, for example. But we do need to note here that the track or which avenue the patient will go down is determined by the assessors only, and not the person seeking MAiD. The other big change that happened in 2021 was the addition of the waiver of final consent. And that's an option for MAiD for people who are at risk of losing capacity. And Dr. Gosselin will speak to what capacity is, but the ability to actually consent and have informed consent. So what happened back in 2020, Audrey Parker's amendment, and Audrey Parker was an individual who lived here in Nova Scotia, and Nova Scotia Health and our program does have Audrey's consent, which she signed before she passed away, to be allowed to speak on her behalf. And what happened was, previous to 2021, everyone who received MAiD had to give their informed consent and would have to have the capacity to consent to MAiD the very moment before the medications are administered. And what happened was that excluded a lot of people who may not have full capacity when they wanted to pass away. So if somebody wanted to live as long as they possibly could, they may lose capacity before their final days. And that meant they wouldn't be able to have MAiD. But that was changed with Audrey Parker's amendment, and it allows for a waiver of final consent, which is a legal agreement between the clinician that provides MAiD and the patient on a predetermined day to receive their MAiD provision and to have their medically assisted death. And next slide. So I did speak a little bit about some of the safeguards that are in place for people seeking MAiD. And some of these the following safeguards apply to people whose natural death is reasonably foreseeable. So your request for MAiD must be made in writing. And for our purposes, that would be the written consent form that a witness has to sign with you. The witness can be anyone other than your own family members or somebody who may stand to gain from your passing. And our office and our program do provide the request and consent form. 2 independent nurse practitioners or physicians must provide an assessment and confirm that you meet all of the eligibility criteria set in the law. And they do have to report these assessments and their work to Health Canada. And the person must be given an opportunity to withdraw their consent and must expressly confirm their consent immediately before receiving MAiD. But there is that one exception when it comes to the waivers of final consent. Next slide, please. So what does MAiD really look like in Nova Scotia in terms of the process steps? Well, the first step is that a person requests MAiD with a referral, either from their physician, nurse practitioner. When that referral is generated to our office, what happens is here in our central office in Halifax, we have MAiD nurse navigators, and these MAiD nurse navigators will help patients navigate the process of MAiD. So what they do is they make contact with the patient requesting MAiD, and they do an intake over the phone with them and collect a lot of information that's necessary in order to process their request. The nurse navigator works with the patient to schedule the 2 independent assessments with clinicians and the patients. And our assessments can take place either in hospital, office, medical office, or in your home, or if you were in a long-term care facility, wherever you are. During your assessments, this is where you would sign your request and consent form. If a waiver final consent applies, you could sign it at that point. This is where your witness signs to say that they know you and that you have signed. And if you are determined to be eligible, after the second assessment comes back as eligible, the nurse navigators and the providers of MAiD can help you with planning your provision, and the medications will be ordered for the day and time that you are interested in. And we do try to accommodate the wishes of the person with the availability of the clinician. So whether you would like to have your medically assisted death in your own home, we have had it before where people wanted to be in their own backyards. We try to accommodate to the best of our ability. If a patient is interested, there is the options of organ and tissue donation that follow a medically assisted death. But if that were the case, it would involve us involving the organ and tissue donation programs, who do have their own guidelines and would work with you and with our program to realize your wish in donating organ and tissues. Another step in the process is what happens to your remains. And we do ask that people have arrangements prior to receiving MAiD. And then finally, there's a lot of documentation, a lot of paperwork. And as I mentioned before, we do have to report every MAiD case in Nova Scotia to Health Canada, and they run a depository and collect that information. They do yearly publish what the statistics are in Canada around MAiD, and a lot of information that helps in the administration of MAiD programs. But all in all, to say that the process does take time, and our navigators are very well versed in supporting the patients through that process. And they do work with patients in terms of their urgency and what their health status currently is to support them to the best of our ability. All right, and I believe now it is over to Dr. Gosson.
Great. Thanks so much, Max. And again, if you guys have any questions while you're listening along, please send them over to Beth. We're happy to answer them to the best of our abilities. And again, or call the office. We're always happy to chat. So we just wanted to talk about some things specific to MAiD and dementia, as that's kind of the focus of this presentation. So I'm just going to go over a couple of things that are important when we look at MAiD for patients with dementia. The first question a lot of people have is, can someone with dementia access MAiD? Max had mentioned before that mental illness is an exclusion to receiving MAiD, but the government doesn't consider dementia a mental illness. It's kind of considered a cognitive disorder, and so it is something that you can access MAiD for. The biggest thing that's important when we're assessing people with dementia for MAiD is they have to demonstrate decision-making capacity, which means they have to know what their illness is, what their treatments are, and they have to understand what MAiD is. This can sometimes be tricky because part of dementia is as it progresses, people often lose their capacity. So we sometimes talk about a sweet spot for MAiD where people are unwell, but they still are well enough that they know about their health, about the options they have. So if someone has lost capacity, then MAiD isn't an option. You have to be able to make the request when you have capacity. So what does it mean to have capacity? So capacity is specific to the decision that we're looking at. And so when we're looking at capacity for MAiD, it means that someone can understand information about their health, appreciate information related to potential treatments, and understand what the benefits or the drawbacks would be to having or not having treatment. So that might, for example, look like my doctor offered me a medication for dementia. I know that if I don't take it, this might happen. And if I do take it, this might happen. Being able to kind of understand, and you can always decline treatment, but you have to have a reason behind it. You also have to be able to communicate your decision about what treatment you want to pursue. So you have to be able to tell us that, or, write it down or communicate in a way that we know. Right now in Canada, it's not legal to have actually, we might go into this in the next slide, but right now in Canada, you can't make an advanced request. You have to be able to say it at the time. So how do we determine someone's capacity? So we know that sometimes people's capacity can fluctuate, and maybe some days are better than other days. And so we really try hard at the MAiD program to make sure we're doing all that we can do to get people at their best so that we can honor their wishes. So we always try very hard to schedule the assessments during a time of day when the person is most comfortable and when they seem to be doing their best. So sometimes we'll talk to the family members and they might say, oh, they do better with morning appointments or maybe better in the afternoon. We kind of try to accommodate that. So we have some of the examples here of what can influence people's capacity of, are they dehydrated? Are they groggy from their medications? Are they getting tired as the day goes on? And we look at those things very carefully to ensure people are at their best when we do their assessments. Next slide. So what happens if someone doesn't have capacity? Can you request it on someone's behalf? And the answer is right now, no. So you can't request MAiD on behalf of another person. The individual has to request it themselves. So that means that you have to be able to make the decision for MAiD and understand the options. When Max was talking about the waiver of final consent, this is a little bit different. So what the waiver means is that on the day of the procedure, if you somehow are too groggy, asleep, not well enough to be able to say, yes, I want MAiD on that day, we can still do MAiD. But the waiver doesn't mean that, you still didn't have to get assessed for MAiD, you didn't request MAiD before. All of that process has to still be in place first. And then if you lose capacity, we can still do MAiD. That's different than all of a sudden you've lost capacity and the family is then saying, we want MAiD now. You wouldn't be able to do it that way. It has to happen first, and we have to have all the paperwork in place. Next slide. So the waiver of final consent happens after someone has already been assessed and has been approved for MAiD, if the assessors feel that this person's at risk of losing capacity. And this happens a lot in cases of dementia, where we know that as time progresses, things can get worse. So the waiver of final consent allows us to pick a date in the future that if you lose capacity before that date, you can still have MAiD. How we do it in Nova Scotia is we can set the date for up to 6 months in advance. And when that 6 months period is approaching, we reassess it. Do we want to extend it? Do we still want MAiD now? We're always kind of looking and assessing that. The important other things to know is the MAiD can only happen with a waiver on or before the date listed on the form, not after. It's also only the person who the form is signed with that can provide MAiD. So we always try to make sure, you know, if someone's going to be on vacation or something, that we have someone as like a backup to sign the form. Next slide. All right, so a lot of this stuff can be confusing. It's a lot of information to provide all at once. And so what we want to make sure people know is where to contact if you're having questions or not sure what to do. So we really recommend you talk with your healthcare provider about the option for MAiD if it's something you're interested in, whether that's your family doctor, if you're seeing a neurologist, a psychiatrist, whoever you might be seeing as a medical professional, you can talk with them about it. You also are more than welcome to reach out to the Nova Scotia Health MAiD program to discuss when an assessment might be appropriate and to find out more information. The other important thing to know is that applying for and being approved for MAiD doesn't mean that you one, have to have MAiD or that you have to have it within a certain time frame. Lots of people who get approved for MAiD die of natural causes, decide they don't want MAiD after all. And sometimes people have MAiD and get it, or they get approved for MAiD and don't have it for weeks, months, or even years later. And we really want to make sure people know they can change their mind at any time. Just because you're approved doesn't mean you have to go through with it. What we want is to give people all the options possible so you can make the best choice for you. A lot of things we also want to consider when looking at MAiD. The decision to request a medically assisted death is very significant, and we don't take it lightly. It's the most consequential decision you'll make because it's resulting in the end of your life. We really recommend you discuss this with your loved ones and friends. It's not a requirement. You don't have to tell anyone, but we really recommend you tell people in your life about it because it's something they'll want to be a part of and involved in. We always want to make sure before people are looking at MAiD that they've done things like made a will, looked at estate planning, mended any relationships that they're looking to mend. It's also important to think about any possible religious considerations. And so we always recommend talking with whoever is a religious leader in your community if that's going to be something that is impacted by having MAiD. Next slide. All right, that was all we had for now. If you have any questions, we're happy to answer them. And it looks like Roseanne has something else to talk about too.
Thank you so much. That was very informative and really gave a lot of information on a very complex topic to navigate. So thank you all to all three of you for doing so. I will, so I'm just, if you have questions, please start putting them in the chat to Beth, as we said. I'll get the questions started with the first one is, if someone does not have a doctor, what should they do? Can they still access MAiD?
They can. We do have a self-referral process here for the MAiD program whereby a patient can call the office or email us and we'll reach out back to them. In that case, if they don't have a primary care provider or a specialist, we would have one of our team clinicians, either a physician like Shiloh or a nurse practitioner. Well, first of all, we would get their consent to look at their medical records and see if they are a potential viable candidate for MAiD. And then this clinician, again, either Shiloh or another physician or nurse practitioner connected to the MAiD program, they would make the official referral for the patient for MAiD. And they also have the option of doing an assessment and also doing the provision of MAiD if the patient is later found to meet the criteria.
Thank you.
Sure.
You mentioned that the process takes time. Can you talk a little bit more about how quickly after applying for the assessments do they typically happen? Are we talking about weeks or months? And second to that, wondering as capacity declines over time, so the longer it would take, the less likely to be accepted in regards to capacity. So I guess
So
the first part, how long is the process typically?
yeah, so the easiest answer is it depends. As Max was talking about the early stages of the process here, whereby the nurse navigators who work with our program, when they do that intake meeting with the patient, it's typically over the phone. It's sometimes in person, but very, very rarely. During that meeting, that discussion, there's a good sharing of what the patient's condition is, what their health status is, and what their wishes are. And so some people are they're just in the planning stages. They want to prepare for something for MAiD further down the road, whether it's weeks or months further down. But in some cases, obviously, we get calls from people who are uh, they're in dire circumstances. Their health status is very tenuous, and they're declining every day, and they'd like to have MAiD perhaps as soon as possible. And we have actually had cases where the process unfolds very quickly. So if we receive a referral, we do the intake, we understand that this person is very much in decline, and they'd like to have MAiD as soon as possible. If we are able to arrange for the 2 assessments to take place, and both assessors find that the patient meets criteria, and if we're able to procure the medications that are required for the process, we can occasionally make it happen relatively quickly. That is not the norm, however. That's why we wanted to stress that the process does generally take time. Um, it takes typically days to weeks at a minimum, because we have obviously as a central referral process or program rather, we're managing cases from across the province. And so we have a small team of our own nurse practitioners who do assessments and provisions. But as you might imagine, they're spread out. They're working across the province on a zone by zone basis. And so we have to basically, again, do the intake, assign those patients to 2 clinicians. They have to go out and meet with those patients and do the assessments. And they also have to study each of the patients as well. They basically look in the health records to understand each individual patient and where they are in terms of the trajectory of their illness, disease, or disability, and understand their recent and perhaps their past medical history even before they go and have that meeting where they're doing those assessments. So yeah, it does take time. So that's what we really want to drive home, is that it typically doesn't happen overnight, basically.
I just wanted to add to that part of the referral process is the nurse navigators assigning a triage level. So if we receive a referral and the referring provider indicates patients at high risk of losing capacity, or patient is extremely unwell, they'll be triaged at a higher level, and we'll prioritize those assessments to be done sooner. So for example, someone who is very stable, doing very well, might not have their assessment for a couple of weeks to a month, but someone who is very unwell, we usually will prioritize that to have it done more in a matter of like days to weeks. So we can't assign a particular timeline, but we do assign triage levels, and we prioritize people that are at risk of losing capacity for those exact reasons the question mentioned.
Okay, thank you so much. I think the takeaway there is that it sounds like it's a highly individualized process that does take time, but you do your very best to meet the wishes of people given the timelines and trajectory of their health situation.
Roseanne, just before you go, one
Yeah.
thing I failed to mention as well is in that process, we are very fortunate in our program that we have 2 full-time social workers, and our social workers will work with our patients, their families, their loved ones throughout the whole process. So some patients will need a little bit more social work assistance. We've had some patients that do some of the planning or or look at things that they should consider. And our social workers are a great asset. So there's a little bit of extra work in there as well that can affect the timeline.
Thank you, Max. And that's a perfect segue to the next question. If you maybe can elaborate, there is a question that says, what type of supports are available for families of the person who has chosen MAiD? And are the social work services more to support the patient themselves or the family circle? So is there anything more you could add to elaborate on that?
Sure. So as I mentioned, we do have 2 full-time social workers. They support our patients and families throughout Nova Scotia, so not just here in Central Zone. They are located here in Central Zone in Halifax, but they do support them across the province. In terms of the supports, they'll work with patients to see what supports that they could use or what supports could benefit them. We have had examples in the past where once social work started to work with the patient and the family, they were able to identify supports for their homes or wherever they were living. And it helped alleviate some of the stresses, and it actually made them push out their MAiD provisions and decide to delay things because they were able to get additional supports. In terms of who our social workers support, so they do support both the patient and the families, and that is pretty much equal there. So on the patient side, they will work with patients who are eligible for MAiD. Some of them will work with patients around legacy planning. So if they know that they still have quite a bit of time before they would like to have their medically assisted death, they can work in terms of when I say legacy planning, they can one of our social workers has worked with a patient in terms of documenting stories of their life that they can then share with their loved ones who are left behind. So there's various things like that. Our social workers do connect patients and families to other services if they think that that might be helpful to them. In terms of the family-specific social work assistance, social workers can work with families, as you might be able to understand that even while a patient may be ready for a medically assisted death, their loved ones may certainly not be at that stage, understandably. So they will work with family members who might be opposed to kind of work through those emotions, kind of work through what they're dealing with, and not in a way to persuade them or coerce them to be supportive, but just to provide that understanding. And they will work with both the patient and the family to kind of bridge that misunderstanding so that the patient can still be supported through the process that they wish to go through. So from our social workers for the family side of the support, they also host in-person grief workshops. It's a 6-week grief workshop in person here. It is here in Halifax because that's where they're located. But last fall, they also hosted a virtual grief session for family members, and this would be after their loved one would have had the MAiD provision. So this is working with families and loved ones to work through the grief process for MAiD. One small thing to say there, the grief process for MAiD is quite different than in other circumstances because the patient going through MAiD is able to choose a day, and it may not be the day where they would naturally have died. And so the families need to process that in a different way. Sometimes there's guilt associated with it, is, you know, the thinking goes kind of along the lines, did I do enough to support my loved one? You know, why did they choose to have MAiD earlier than their disease process would have caused their death? So it's a little bit different than other types of grief, and our social workers are pretty amazing in terms of the support that they offer to patients and families.
Thank you so much, Max. That sounds like a lovely team approach to really support both the individual and their care partners, which is so important. As you say, it's a unique situation and unique grief being experienced by the family around the person. Segueing somewhat into that discussion, what you just shared. there's a question that says, if my mother consents now and she has dementia, how do we decide when is the right time if she loses capacity? Does family decide when she can or cannot? So I think some important clarification and context could be offered here around that situation for people with dementia. If Dr. Gosson wants to take that, or
Yeah, absolutely, because this can be really tricky. So, if your mother is looking for, or anyone's looking for an assessment for MAiD, we would do the assessments now, and part of that assessment would be determining capacity. So if the patient is found to have capacity and is approved for MAiD, they could then choose a date in the future where they could sign a waiver of consent. So say, for instance, a person is approved for MAiD today, they want to sign a waiver because they're doing okay right now. They don't want MAiD quite yet. The maximum amount of time we could set that for is 6 months. Over the course of that next 6 months, that means they could have MAiD at any time. So it really is kind of up to the family, where if they say, you know, mom's not herself anymore, she's not recognizing us, she's in a lot of distress, they would then call us. We would have to come and see the patient and say, yes, they've lost capacity, we can go ahead and do MAiD. So we do rely on the family member to reach out to say, hey, they've lost capacity, we want to go ahead with the procedure. Otherwise, we would plan to have MAiD on the date that was set 6 months in the future. So we would call usually like a month in advance to say, hey, your date's coming up in a month. Are things going good? Do you want to push it out? Do you want MAiD on that date? Do you want it a bit earlier? So we kind of have those designated check-in points, but at any time before that, a family member could call and say, hey, they're really not doing well. You know, maybe they don't recognize me anymore. And we encourage individuals to have those conversations with their loved ones to say at what time they would want to, right? Because we want it to be the patient's choice and the family members supporting that choice. So we know the person has already made the request for MAiD, that's consistent with their wishes, but the exact date, we really encourage people to have a conversation between the MAiD provider, the family members, and the patient to determine what would it look like to say that I'm at the point where I need to go ahead and have the procedure if it's not on that specific date that we picked. For most people, we pick a specific date and we do it on that date. The waiver is just kind of some extra protection that if they've lost capacity before that date, we can still do it.
thank you. That's yeah, that's complex. When you when you talk about MAiD being complex, it's there's a lot of nuances and individual circumstances, especially around
I will say too, when someone's approved for MAiD, whoever the provider is usually provides their direct contact line, and we encourage family members to reach out if they're having concerns, if the person's health status has changed. We always want to be kept updated. And so that you would have kind of a contact point person to reach out to, as well as the MAiD office, to say, like, you know, they're taking a bit of a downturn, not sure how things are going. And, you know, once you're a patient with us, we want to know what's going on and we're there to help support through it.
Okay. Thank you. And building on the 6-month window for those waivers of final consent, how many times can that waiver be kind of pushed out for another 6 months? Is there any limit to those parameters, or?
No, no limit. The only limit is the patient has to be capable to sign a waiver. So when we go to, if say the 6-month period is coming to an end and the patient says, I'm still doing good, I want to push it another 6 months, we would assess to make sure they still had the capacity to understand what that meant. So that would be the limiting factor. If they've lost capacity, they can't sign a new waiver. But as long as they still have capacity, they can just keep renewing it.
Okay, thank you. And you mentioned, you know, setting up the best circumstances for the person to be at their best at the time of when they're being assessed for capacity. It sounds like the person's capacity can vary throughout the day or from day to day. And so that is okay as long as they demonstrate capacity during the assessments. Is that a correct understanding, or?
Yeah, absolutely. Yeah. So at the time of the assessment, they need to have capacity, and then that we can have the paperwork kind of sorted and done.
And that's actually part of the intake process as well. Roseanne, our nurse navigators will have that conversation with the patient to say, you know, what they'll try and understand what medications they may be on and the type of impact that they have on the individual, and say, you know, as time goes by during the day, the effect or the impact of that medication may wane somewhat. So we could plan for the assessments to take place later in the day, so the impact of the medication does not interfere with their capacity to understand and consent to MAiD.
Okay, thank you.
Sure.
So, so I'm just envisioning that a family member who may have concerns around MAiD might say, well, mom or dad or somebody does not have capacity. They clearly don't this afternoon, but maybe, but maybe in the morning when you were assessed, when the person was assessed, they were able to demonstrate capacity. So it's really that in the moment assessment period that matters the most.
I would say that during most interactions that a patient has with our staff here, whether it's the navigators or the physicians or nurse practitioners doing assessments, they're almost always evaluating for capacity. They're asking the type of questions that a person really needs to think about to be able to answer the question. And so they're kind of always, it's kind of an ongoing process. It's not a one and done thing. It's an ongoing thing for sure, always evaluating just to ensure and be assured that the person does have capacity in the moment.
Okay, thank you. And there was some discussion around the safeguards that are in place. Can you elaborate on the emotional safeguards that are in place at the time of MAiD for the doctors and family members?
So for the clinicians involved in MAiD, we have a pretty solid ability to communicate and connect with our MAiD practitioners, our physicians and nurse practitioners who are involved, and ensure that they feel supported and that they have access to the resources that they may need to connect with someone to talk about the process that they're involved in. MAiD is heavy work. There's no doubt about that. It's difficult for anybody involved. And as you can appreciate, over time, as a clinician takes on more and more cases, the impact potentially can be greater for them. And so as employees of the health authority and as physicians who are part of Doctors Nova Scotia, we all have access to EAP programs that we can call someone and basically have a counseling session whereby we talk about the stressors of the role and challenging cases and perhaps complex family circumstances that are unfolding, and just kind of get it off our chest. And that's a really important thing to be able to do. Here in our office, among the staff who work directly with us here, we have a daily huddle where we all talk about what's going on and what we're up to, what's challenging, and what do we need to do to circumvent any challenges that present. And we also have every Friday a very in-depth case discussion where we review complex cases, whether it's complex family dynamics or physical realities around a patient and access to them to do the MAiD provision. And in terms of the patient and family members, as Max has talked about, we have our social workers who are just fantastic. They're brought in as needed. And again, the nurse navigators who largely do the case management here, that is one of the questions. Could you benefit? Do you think that you would need to meet with a social worker to get some support while you're going through this process? And because we all work together here in the same office, the immediate team does, making that referral and ensuring that referral is carried out is very easily accomplished. And we're a very robust and self-supporting team. We're very fortunate to have the group of people around us that we do, and very supportive of one another, and certainly of our patients and their family members as well.
Thanks, John. It's really, really important and lovely to hear about the supports in place for the clinical team, as well. As you say, it's very heavy, demanding work, and to have those supports for them to be able to carry on and make sure this provision continues to be available to people in Nova Scotia is so important. So for their own health and well-being. So,
Roseanne, I'll just add to that piece as well. We're currently in the process of setting up a support group specifically for our MAiD clinicians. It's not a traditional type of support group. It's a very specific type. Not sure, some of you may have heard the name before. It's called a Ballant group. And it's a specific non-judgmental support kind of network for clinicians to be able to share some of the heavy things that they see through this work, without someone being like, well, you should do this, you should that. It's very much just about being able to share that experience. And as we all know, talking about it makes it a little bit easier. And the other thing too, we say to patients and their families is, when it is time for the day and time of someone's provision, it's your choice. You can have as many people present as you want. You can have as few people present as you want. You can bring in people from your religious backgrounds if you want that support. People have had music playing. One thing when I first started here with the program, I still can't get it out of my head. We had a provider show up to a home to give a provision, and there was a very large kitchen party prior to it. That's what the wish was for that patient. So we try to make as much accommodation as we possibly can.
Wow, yeah, that image I imagine would stay with you of a robust kitchen party. And it looks like we have time just for one more question, and it kind of segues again into the last question that we'll have time for is, can you just speak a little bit about what the actual provision looks like, for those of us who don't know what that process is all about? Can you just elaborate a little bit on that, please?
Sure. So the clinician would have made arrangements with the patient to align with their date, time, and location requests. And so the clinician administering the medications would have ordered the medication from a pharmacy prior to. If it's in hospital, we always use an in-hospital pharmacy, and if it's in the community, we use a community-based pharmacy. And so they would pick up the medications and take them to the patient's location, wherever they might be. And again, home, hospital, long-term care facility, hospice. We have even done provisions whereby a patient was laying in their canoe that was pulled up to the beach at their cottage, which is wonderful. That was their favorite place to be. And so the clinician arrives, they have a talk with the patient. One of the very first things that they're going to do is, if there's no waiver in place, they're going to, of course, evaluate for capacity. Because a patient still is required to give express consent in the moment, in the absence of a waiver of final consent, they still do have to ensure that the patient does have capacity to understand that they want to go through with this. And they also offer them, again, the opportunity to withdraw from it if they wish. And just to touch on that aspect, if I can, for a second, we have had cases where patients go through the process, they're evaluated, they're assessed, they're found to meet the criteria, and they say they plan the provision for sometime next week, for example. The physician or nurse practitioner shows up to do the procedure, and the patient goes, I am not ready. I thought I'd be ready, but I'm not. And so that is not a problem. We put everything on pause. The medications are returned to the pharmacy wherever they were picked up. And the patient is always given the option, if you would like to do this further down the road, whether it's next week or next month or whatever, you have the option of calling and re-engaging the process. And we pick up from where we left off. We don't have to start again with a new referral and new assessments. That would be a huge burden to people. So we try and make it as simple as possible. And again, if they wish to move forward at some point, it just involves a phone call to the office here or directly to the clinician who would have done the provision. And we start it over again, basically. But again, the clinician is having a conversation with the patient and with any family members gathered there. They would say that, there are 4 medications that we have to administer as part of this provision. And they would suggest that people prepare to say their final goodbyes, because the medications work very quickly. And a person can pass, depending on their how robust their health status is currently, they can pass quickly, like within 4 to 10 minutes, in that kind of range. I guess that's probably a typical range, I think. but they would describe that, once the medications are administered, the patient will fall asleep. There may be some bluing of the lips, and they'll just say that the patient falls asleep and they pass within that time frame. And the thing that everybody describes about the MAiD provision is that it's very, very peaceful and it's very dignified. And typically when people emerge from that setting where a person has had a MAiD provision, they often get in touch with us and later on and they say, that was a beautiful death. That was really great that the person had the opportunity to request this and to make the arrangements according to their wishes. They can have in the room those who they wish, close family members or friends, like whoever they determine is in their circle of care, that's who can be there. Which is different from a patient, passing in the middle of the night where nobody is with them, nobody's around them on their own. So it's very well communicated. It's thoroughly communicated and discussed how it happens and the medications that are used and how long things take. And we just want for everybody in the room to understand the process so that there's no surprise or shock at how quickly the person passes after the administration of the medications.
I just wanted
Thank you so much. Oh, go ahead.
To add in, yeah, just one quick little thing. I always describe it to patients. So the medications we give are very similar to medications we give when we're putting people under for surgery, anesthesia medications. We just give them at much higher doses. So I always ask people, have you had surgery before? Do you remember how you were awake and then you weren't? It's exactly like that for the MAiD procedure in terms of it being a very, quick, very peaceful, not any kind of pain associated with it. So that sometimes helps people understand what it might feel like to think about when they've had surgery.
Thank you so much. Thank you to the three of you again for leaving us with this beautiful image of a peaceful death as per someone's wishes and choice. It's really been a wonderful educational opportunity. We really appreciate your time and sharing of your expertise today. And as you'll just see popped up on the screen for our attendees today, there is a quick poll. We'd love to hear your feedback on today's session. And if you ever have ideas or topic choices that you would like us to consider for future AlzEd presentations, please, we'd love to hear about those and provide the education as needed by our audience members. Before we go, I'm excited, speaking of education, I'm excited to share another educational opportunity with you coming up very soon. January is Alzheimer's Awareness Month, and so next week on January 28th, we'll be hosting our annual Awareness Month event at the Woodlawn Public Library. The event is called Hope in Action and will feature three more superb speakers who will cover topics including new medications on the horizon and the importance of socialization to help reduce your risk of dementia. So we'd love for you to join us in person or on our virtual live stream across the province for that event. And more information is available on the website. And I think Beth might have shared or will share the link for registration to that. So please mark your calendar, save the date, and we look forward to seeing you there. And next slide, please. Just a final thank you again to Dr. Gosson, John, and Max for generously sharing your time and expertise and helping us to navigate this important and complex topic. It was a pleasure to have you. Thank you for everyone for tuning in today. It was also a pleasure to connect with all of you through these virtual learning sessions. As I said, please send your comments or suggestions in the chat or call our office at 1-800-611-6345. If you have questions about dementia or would like to have a confidential call with one of our helpline staff, please call the number on the screen. If you have questions specific to the topic today of MAiD, please call our MAiD experts, Nova Scotia Health, or email. I think their contact information has been made available. And as a final wrap up, this session was recorded and will be available on our YouTube channel in the near future. So you can watch it again or share it and use it as a resource with anyone who may be interested. So with that, it's 2:35. Thank you so much again for tuning in everyone. Take care, and we'll see you hopefully at our upcoming sessions. Bye-bye.